My favorite part of my job, this is so cliche and I hate it, but I love it, truly, is just seeing the smile at the end. At the end of whether the patient had one filling and they didn't think they could do it, they were so nervous, or they had that cold sensitivity that we're talking about and we just did the smallest thing and their life has changed. And that's really cool to see. And then also, of course, a full veneer case, a full crown case, and they're just so confident at the end of the day and they say, I wish I did this sooner. That warms my heart.
Welcome to today's Heart of the Hustle. I am here with Dr. Kelli from Dallas Laser Dentistry.
Hi.
Welcome.
Thanks for having me. I appreciate it.
So I can't say your last name.
That's okay. No one really can. That's why I go by Dr. Kelli. So my last name is Dummerth, which the TH kind of gets lost in the end of my name. So sometimes it just sounds like dumber. So we go with Dr. Kelli. I got married recently. Am I going to be changing my last name? I still don't know. So Dr. Kelli is perfect.
Yeah. It's a hard choice.
Yeah.
To change your name or not.
Yeah.
I've done it and I'm remarried and I didn't change it this time.
Yeah.
Also, my last name would be Pie. And so then I would be Sherry Pie.
That's cute.
And if anyone knows that song from the 80s, Cherry. Yeah. So, yeah, everyone loves teasing me about that when they know my husband's last name. So we kept our maiden name.
That's fun. I get that. I get it, but that's cute.
So tell us a little bit about you. Why dentistry?
Why dentistry is always a good question. So whenever I was growing up, I knew I wanted to be in healthcare. I loved being creative. And then I went down my own orthodontics journey. I think we touched on this recently, talking about I had headgear as a child. I think you did too. Not to out you.
I did have headgear. We should find some pictures of ourselves with the headgear. I don't know if there are any. I wouldn't allow that to be photographed.
No, not exist. No, not for me either. So that was a whole journey for me. I hated it. Hated going to the orthodontist. I just wanted braces. Finally got braces after my headgear. And once my journey was over, I finally realized, wait, these people are really cool. Loved my orthodontist. Loved the staff there. Their lifestyle is amazing. They drove really cool cars. So after that, I kind of fell into that dental world. And I'm like, wait, if I want to be in healthcare and I like being creative, this is right up my alley.
Yeah.
So
yeah, because I think you landed there, especially if you're doing like restorative dentistry, which I know you specialize in, and we'll talk about that in a minute. It is kind of a mix of art and science, right?
Yeah, absolutely. Absolutely. Working with your hands, getting to see what you create come to fruition is very special. And I love getting to see that every day.
Yeah. Mm-hmm. So tell us a little bit about what you focus on. So what is restorative dentistry?
Restorative dentistry is whenever we're trying to recreate a tooth to look like an original tooth, or maybe we're enhancing it to make it look like a tooth, but maybe a little bit better than where we may have started at.
So we're talking about our hockey players, probably.
Mm-hmm. Yeah, starting maybe from ground zero in some cases, Jack Hughes, but yeah, something like that.
Is he the one who in the Olympics knocked his teeth off? And if anyone hasn't seen it, go watch the clip of the Olympics in 2026. And towards the very end of the game, one of the American players has his tooth knocked out and he's bleeding as he's getting his gold medal.
It is going to be a classic photo and classic meme for years and years, I'm sure. Yeah.
Okay, so have you zoomed in on his pictures and seen what he needs?
So some of the pictures I think are AI. So it's kind of hard to find an original, I think, because I've tried. I've looked, and I'm not sure.
So what could be the options for him?
Mm-hmm.
If he's got any tooth left, is that sort of what you would decide if there's tooth there or if it's out?
Good question. I don't think that he has a tooth left. I think he actually had either one knocked out whenever he was younger and he's just kept having it filled. This kind of goes into our cosmetic dentistry segue of we do want to build something for him, but we don't want a long-term option because he's still playing hockey. He's still getting hit in the face. He's still finding a way to get hit with a puck. Still getting in fights, right? Him and all the other ones. So how do you find a short-term solution for what will end up being a long-term problem? So cosmetic dentistry comes in.
Yeah. What would that option be?
A short-term thing for a lot of hockey players is just to do some cosmetic bonding. And that's adding a little bit of composite, which is that tooth-colored filling material, just onto the tooth itself. And then later, once they finally retired, then they can talk about a long-term option, like maybe an implant, maybe a bridge, something like that.
What's an implant and what's a bridge?
Yeah, so an implant is a little screw, sometimes a larger screw, that goes into the bone, and that acts as the root of the tooth. It takes on that physiological function of a tooth root. So the implant won't have any innervation, but it looks and acts just like a normal tooth.
Okay. So it's essentially a fake tooth that's held in there with a screw.
With a titanium post,
for lack of a better word.
Yeah.
But you wouldn't want to do that on him until
he's retired.
Yeah.
Yeah. We'll wait for retirement for that.
But if he doesn't have a tooth, then there's nothing to put bonding on.
Oh, then he just looks like a hockey player.
Well, that's true. That's part of the appeal of hockey players.
That is the appeal, right?
I can talk about this because my husband, the Pie that we were talking about earlier, Billy Pie, is a hockey player.
Pie.
So, and kept all of his teeth.
Oh, that's amazing.
I know. It's
Congrats,
crazy.
Billy.
It's crazy. Do you have a lot of athletes who come in?
Do we have a lot of athletes who come in?
Okay, we could say no.
Yeah.
No. Okay. Strike
Okay.
that question.
It's like, I'm not sure on that.
So you've mentioned restorative dentistry and cosmetic dentistry. So what? I don't understand the difference.
Cosmetic dentistry can be restorative at the same time. It depends on the patient's problem. It depends on their chief complaint. What do they want to see with their smile? What are their goals? What is going to make them feel better, maybe function better? It's not always just, give me a set of veneers and I'm going to smile and everything's beautiful at the end of the day. A lot of times there's actually a functional aspect to it, and we're trying to rebuild someone's health, life.
Yeah.
And
like sometimes is that just because they lost a tooth? Is that one of the only reasons why they need it to be regenerative?
No, not necessarily. I mean, outside of the vanity, which patients always kind of regret bringing up, is they say, well, I don't want to be vain, but feel good. Do it for yourself. What's going to make you feel good? What's going to make you sleep better at night? What's going to keep you eating your favorite foods? That's what we want to do for you.
Yeah. Yeah. Because you find that people don't eat their favorite foods just because they hurt to eat?
Yeah. They're limited. Maybe it hurts to have certain foods. Maybe they're getting stuff stuck in their teeth every time. They're avoiding barbecue. We're in Texas. You can't avoid barbecue. You need that. So we want to keep people having the daily experiences that they want to have.
Their favorite things.
Yeah.
When you talked about that, the first thing I thought of was ice cream, right? And cold sensitivity.
Yeah. Yeah. A lot of times recession over time. That's typically due to an occlusion problem. Like your bite.
You're using big words.
Yeah.
Okay.
So
it's recession and occlusion.
Good call.
Okay.
So a lot of times people are getting restorative work done, which are those fillings, veneers, crowns, something along those lines, because of a problem where their gum line is actually being moved down, and sometimes bone level also is being moved down. And so you have more of your tooth structure exposed, and that causes sensitivity over time. For some people, it goes down really far and they never even feel sensitivity with it. And then for others, you get just a little bit of exposure, a little bit of that gum recession. Very painful. So we try and keep people from having to have that.
How do you prevent that?
It's typically an occlusion problem. So like you just asked, what is occlusion? So occlusion is your bite. We want to make sure that your bite forces are being directed in the right way. Whenever you have your teeth crowded or leaning or tilted.
Like bite the wrong way. And,
yeah. And then that can cause that recession or that recession over time.
Yeah.
Mm-hmm.
Yeah, when I'm in the middle of Invisalign treatment right now.
Oh, good.
And it's amazing how like my teeth match now, if that makes sense. When I bite down, I don't think they ever did. I wore braces and headgear and all the things, but it was always a little crooked, and I can feel, how that they now match up. So is that kind of what you're talking about?
Exactly.
Yeah.
Yes.
And so do you recommend Invisalign for other patients to do that, or is there some other way to fix that?
Yeah, a lot of times we are starting with Invisalign or some kind of orthodontics, like braces, like that bracket ortho. Sometimes we're doing that, and sometimes people want that instant gratification, and they're not looking to go down that whole road, or they know they're not going to be dedicated to that kind of process because, as you know, it takes a lot of commitment.
Yeah.
So sometimes we're actually just doing a full mouth rehabilitation, which is actually drilling on your teeth and setting it up so that your bite is fixed by restorative work rather than the orthodontic movement.
So basically replacing all your teeth with crowns, but crowns that will then fit where your regular teeth didn't?
Yeah, not necessarily replacing the teeth, but kind of reshaping or remodeling the teeth in a way.
Oh, that's interesting.
Yeah.
Yeah, Invisalign does take a minute to. It takes some commitment. My 15-year-old son is doing it with me, and our dentist is like, he's so compliant, and so I'm shocked because I guess younger kids,
That's a
are not
rarity.
very good at it.
A rarity, yeah. Yeah.
So do people still get like the full metal braces?
Yeah, a lot of times people still do. I would say most of the time patients would rather have Invisalign, but sometimes there are still those situations that somebody is a better candidate for the metal bracket orthodontics. Yeah, and something like you said earlier, the compliance is usually the biggest thing of what turns patients towards that other road.
Because they're easy to take out and forget about.
My husband's doing it right now too, and he threw them away in Mexico, and he's digging through the trash. Yeah, it was a good time.
Knock on wood, I haven't done that yet, but it's going to happen.
Yeah.
I'm sure. It'll probably happen the day this airs.
Just keep your case with you. Yeah, that's the biggest thing. Just keep your case, and then you're always going to, not always, but you're going to be inclined to put it in there.
But I have a cute little purse, and it doesn't fit in my cute purse.
I get that.
It's hard being a woman.
It's hard. It's hard.
So what's your favorite part of your job?
My favorite part of my job, this is so cliche, and I hate it, but I love it, truly, is just seeing the smile at the end. At the end of whether the patient had one filling and they didn't think they could do it, they were so nervous, or they had that cold sensitivity that we're talking about, and we just did the smallest thing, and their life has changed. And that's really cool to see. And then also, of course, a full veneer case, a full crown case, and they're just so confident at the end of the day, and they say, I wish I did this sooner. That warms my heart.
One of the things that a lot of people struggle with, including me, is just kind of being a wimp about going to the dentist and not wanting to be in any pain and the sounds and all the things. So how do you help put patients at ease?
I think that's a great question. I am a super relaxed person. I'm very chill. I try and put that off for my patients as much as possible, or put that on for my patients as much as possible, because it is scary. Why do I need to be scary? I let them know, trust me, I'm taking your health very seriously. I take my job very seriously, but I also just want you to feel like we're kind of hanging out whenever you come in. I don't want you to be nervous about it, or at least more nervous than you might already be. So if I am going to make a stupid joke or be silly or be sarcastic with you, and that will make you feel a little bit better about being here, then let's do it.
Yeah. What do you think the main difference is with Dallas Laser Dentistry over some of the other folks?
Oh, I think the environment that we try and do for our patients, that we try and put off for everybody. Our team is super close, and I think that that's well received by all of our patients. I think everybody knows that comes in through the doors, and we care. We really, really do care, and I think it's obvious.
And you've been around for a long time. I think that shows too, right? That people have worked there for a long time, sometimes decades, I think, right?
Yeah. Whenever I found my job here, I just moved from Kansas City last summer, and I joined this team, and it feels like home. I couldn't say it any more than that, but it's the best.
And how many people are on the team?
We have 10 people on our team.
Okay. And how many doctors?
We have 2, Dr. Swift and myself.
Excellent. Excellent. You must be learning a lot, because I know Dr. Swift has been doing this for a while, right? It must be nice to have a mentor like that.
It's the best to have a mentor like Dr. Swift. Yeah. I couldn't agree more.
I think it's hard to find.
Yes, I would definitely say so. I talk to my friends a lot about their experiences, the jobs that they have, the various jobs that they've had, and who has kind of continued to inspire them. And I feel really lucky and blessed to have my opportunity.
I think that there is a big difference these days between there's sort of smaller private practices like the one that you work for, and then there's these larger, almost franchise dental clinics. I read an article yesterday in Forbes about, a billionaire, dentist chain that's, all over the country now.
Yeah.
What do you think the difference is? I don't know if you've worked at both, but I'm sure you have friends who are working at some of those. What do you guys see as the differences?
I think, again, the thing that really sets us apart from some of those other offices and just other ones in our area and even outside of our area is that homey feeling that you get whenever you come in. And that we care based on that.
Yeah.
Mm-hmm.
And that stuff shows,
Mm-hmm.
right? Versus sort of the, the more franchise type places.
I think so too. I really do think so.
Yeah. So tell me about implants. Like,
Mm-hmm.
why would you need one?
A patient can need an implant for multiple reasons. Sometimes you lose a tooth. Sometimes you did never have a tooth come in. Sometimes you have a scary accident and you have to go down that road. Sometimes we have no idea why. And you lose a tooth and it's very scary and it's super intimidating. But what we do whenever we're restoring a tooth with an implant is after the tooth comes out, depending on the bone situation, and we can go into this a little bit more if we'd like to, but we're able to place an implant, which is it just looks like a screw. Looks like a screw with kind of a hole through it. Patient never has to see the hole, but it's just a screw that goes into the bone. And
that's your jawbone up here? Okay.
Yeah, so it just goes right into the jawbone. It sits right at that gum level, and then that heals over time. In about 3-4 months after the implant is placed there, then you can get the crown of the tooth, which is the cosmetic just tooth that you see. Ignore the root part, which is that implant that took the spot, and then the crown will just look, act, function just like a normal tooth and really restore the patient to the bite that they've had before or maybe never had and now have, which is really special. And then that cosmetic appearance that they've been missing out for a little while.
Yeah.
Mm-hmm.
Do you have to go without a tooth for a while while the titanium
Mm-hmm. While it heals,
for lack of a better term, while it heals, or can you put like a temporary on there?
Mm-hmm. There are a couple different options for temporaries. Everyone's a little bit different on what will work best for them. Sometimes you have a little retainer that has a little tooth shape in there. You snap in the retainer. It looks like those Invisalign trays that we've been referencing over and over, and it looks kind of like that, where it looks like you have something. Another one is a small little partial, and it's like a little acrylic piece that you can kind of snap in. Looks like you have a tooth there. You take it out to clean it. And then another one, a little bit more rare, but sometimes whenever the implant is placed, you can have a little temporary tooth on there. So it's not as common, but it can happen.
What are the most common reasons why people need those? Why they need the implants?
Just losing a tooth, losing function.
Yeah. How does that? This is my worst nightmare, is losing a tooth. Like, literally, I will wake up at 2 a.m. So, like, I need you to tell me that it's not going to just happen. Like, and maybe it will, right? Is it because I'm not taking care? Does it happen because you're not taking care of your teeth? Is it trauma? Is it, maybe just something goes bad, or you didn't get a root canal quickly enough? Like, what are kind of or you're a hockey player and it just got knocked out, which,
right. There are tons of reasons that people lose teeth, and some of them we don't know about randomly. And this is going to be so scary to hear about. I don't know if we should, but a tooth can have some kind of resorption inside of it. And a lot of the time the reason isn't completely known. Sometimes a patient can have just some resorption of the inside or the outside of their root, the canal of the tooth.
Wait, so your body eats your tooth?
Essentially, yeah.
That's pretty cool, actually. That's not scary. That's cool.
Oh, good. I'm glad it's being inspiring for you.
So that can happen. I don't want to talk about it anymore.
Yeah.
It's cool. But okay, so what are some of the other?
Sometimes fractures, a fracture of a tooth. So some of those older fillings, they're called amalgam. They're the silver looking fillings that a lot of people have had. Over time, that material actually expands. Functionally, it expands to try and fill in little micro cracks of your teeth, but they also cause little micro fractures in your teeth. And so if that works a little bit too well, then the tooth can actually fracture over time. And then if that tooth fracture is too deep, like underneath the bone line or bone level, then the tooth needs to come out.
Yeah.
Mm-hmm. And that's an example of how a tooth can fracture.
Yeah. What are some of the other things?
Trauma, hockey.
It's all
coming back to hockey.
It all comes back to hockey.
No, I love hockey. NHL is my favorite. Anyways, trauma is a big one. Losing a tooth due to a cavity, due to decay. It just gets too extensive. Maybe a tooth fractures because a patient never got a crown after a root canal. That can be a reason why the tooth becomes more vulnerable and it gets a little too far.
So some of it is also just take care of your teeth.
Of course. Yeah.
What's the one thing you would tell people about how to take care of their teeth?
Come into your dentist every 6 months.
Yeah.
Let us look.
Yeah.
Mm-hmm.
And get cleanings. Like, are cleanings important?
Yeah. Get a cleaning. Sometimes it might be even more than every 6 months, but let's get some eyes on your teeth twice a year. And let's just make sure that you're doing well.
Yeah.
And then I'll never need to do an implant on you. And it'll be great.
Unless you play hockey.
Yes.
It all comes back to hockey.
We all circle back around. Absolutely.
We need to connect you with the stars. Stars, if you're listening, this is your dentist.
Hey, hockey girl.
So if I ever do have to get an implant, how do we make sure it looks good so it doesn't look weird?
That is a really great question. So a lot of dentists and maybe a lot of providers that place implants will look at the bone and say, this is the best place for an implant to go. Let's tilt it like this. Let's have it come out over here. And you can make it as easy to place as possible. So what I do as a cosmetic dentist, I am looking at what's our end goal. What are we going to do to make sure that we get the most cosmetic outcome? So I'm looking at it as I'm designing where this implant is going to go. I'm putting a tooth on first. Digitally, I'm adding a tooth to your smile. I'm seeing how are we going to angle this to make it look and act just like a normal tooth. So I do that first, and then I decide how are we going to place this implant? What size are we going to do? Where's the bone going to go? How are your gums going to look afterward? Those are some of the biggest things that I think patients don't really know as what is going on behind the scenes of how we're getting to your gorgeous smile at the end and not just how are we replacing a tooth.
And is that different from other dentists who just do the implants?
I think so. I think that's really what sets us apart in our office is that, again, we're very cosmetically focused. So that's the first thing that we're looking at is you came to us to replace a tooth. Now we're going to make it look good.
Because you don't want I don't want any work done that's not going to look good.
Exactly. Yeah.
I think we've all had that experience, right? Where it doesn't match.
Mm-hmm. Mm-hmm.
We never want that to happen.
Exactly. Yeah. And we're never going to do something that's not going to look good. If something comes back from a lab or if something we had a plan and it doesn't look that great, we're doing it again. And we're doing it again until it looks perfect.
I love
until the patient's happy.
Yeah.
Mm-hmm.
I love that.
And I'm happy because I'm also a harsh critic. So.
Because you want it to look good.
Mm-hmm. My name's on it.
Yeah.
I want it to look good for you too.
Of course. Sign the back of every tooth, right?
Yeah, my initials are carved in. Absolutely.
But I think that's true. If you think about a lot of dentists, if I think about the ones I've gone to, I don't think I ever looked to make sure that they had a cosmetic angle that they were coming at it from, right? I was like, just fix, I need my crown hurts, fix it.
Mm-hmm.
But yeah, if they don't have a cosmetic viewpoint on it, they might put it into the wrong color or it doesn't fit, which is that both of those things happened to me a couple years ago.
Mm-hmm. Exactly.
So when you're in dental school, is there a specific track you take to learn the more cosmetic side of things, or is that something you learn afterwards?
Sometimes. Some dental schools do have a track that you can go down. Mine specifically did not. So after dental school, I went and did a GPR, which is a general practice residency. And that is an additional year of training. It doesn't get you an extra degree. It gets you a certificate. It didn't help me get any more money, but it helped me treat my patients a lot more comprehensively. And again, with that aesthetic eye that dental school doesn't totally prepare you for. You get some background, but I think it's really important to dig deep and find those key pearls that will make sure and really set you apart. So I took the extra year and really committed to that.
That's awesome.
Mm-hmm.
Okay, so if the Dallas Stars or the Dallas Cowboys need to find you for their athletes when they knock their teeth out to do a wonderful implant that's very cosmetically focused. Where can they find you?
So we are at Dallas Laser Dentistry off of Walnut Hill and 75, right across from Presby.
Awesome. Thank you so much for being here.
Thank you so much. I appreciate it. This was fun.